Assalamualaikum warahmatullahi wabarakatuh. My name is Socorro O. Taratingan from Group 10. So today I will be presenting the case study of Mr. Richard Del Campo, a 42 years old male from Tagum, Davao del Norte. So he was admitted with the diagnosis of schizophrenia disorder and tobacco use disorder. So meron akong apat na objective dito sa presentations. So first is to understand the schizophrenia and its impact on Richard behavior and functioning. Next is to apply Erik Erikson and Piaget's theory in analyzing his development. And next is to identify the signs and symptoms and management strategy. And the last one is to provide recommendation for his rehabilitations and recovery. So, proceed tayo sa definitions. Ano nga ba yung schizophrenia? So, schizophrenia is a chronic and severe mental disorder that affects on how a person thinks, feels, and behaves. So, patients often lose touch with a reality and may experience hallucinations, delusions, and disorganized thinking. So, it requires a lifelong treatment and supports, which is why it is considered one of the most disabling mental illness. So, proceed tayo sa psychiatric history. So, Richard chief complaint was violent behaviors. So, his symptoms first appear in 2017 and he relapsed in 2022 after the death of his maternal figure. So, which became the precipitating factors. So for his predisposing factors include family medical history, substance use, and possible genetic vulnerability. So for primorbidly, Richard was described as socially withdrawn with and dependent on family and also showing a poor coping skills and low self-esteem. So, proceed tayo sa psychodynamic by Erikson's stages. So, we can see that Richard Del Campo faced challenges in almost all stages. Why? Because as a child, he struggled with trust, autonomy, and initiative. So, for the adolescent, he experienced identity confusions, and for the as an adult, he failed to form an intimate relationship and became socially isolated. So for the currently, he shows signs of stagnations as his illness prevent him from fulfilling productive roles. So proceed tayo sa psychodevelopmental by Piaget's stages. So according to Piaget's theory, Richard may have had limited social interaction during childhood, so which affected his ability to develop abstract thinking and adolescence. So this difficulty in processing and coping with stress may have contributed to his vulnerability to schizophrenia. So, proceed tayo sa sign and symptoms. So, Richard Del Campo shows positive and both positive and negative symptom. For the positive symptoms is meron siyang hallucinations, delusions, and disorganized speech. And for the negative symptoms naman is including dito yung flat affect, poor hygiene, social withdrawal, and lack of motivations. So, these signs and symptoms greatly interfere with his daily functioning. So, proceed tayo sa psychiatric assessment. On mental status examinations, Richard appeared poorly groomed. His behavior was withdrawn, limited eye contact, He displayed disorganized speech and labile mood and also a blended affect. So thought process was slow and disorganized with delusions and auditory hallucinations. So his cognition was impaired and he showed a poor insight and judgment. So, proceed tayo sa psychopathology. Psychopathology. So, schizophrenia is a primarily a thought disorder with a biological basis involving dopamine dysregulations. But psychosocial stressor such as unresolved grief, family conflict, and substance use also play a role and Richard relapse. So for the psychiatric management, uh, for the ideal psychiatric management is including long-term use of antipsychotic, psychotherapy, family educations, and community programs. And Richard Actual case, the doctor order flupendexol, fluphenazine, and clozapine along with atorvastatin for his cholesterol. So, he is also encouraged to undergo substance cessations and supported therapies. And next is proceed tayo sa nursing care plan. So, wait lang. Psychiatric nursing management. So, proceed tayo sa nursing care plan. First is we need to ensure the patient safety to prevent we need to ensure the patient safety to prevent harm to self and to others due to hallucinations or aggressions. And and next is use therapeutic communications. Kailangan natin mag-use ng therapeutic communications to build trust and also to reduce anxiety, and maka-help din siya para ma-express niya yung thoughts niya. And then next is assess with the self-care activities to negative symptoms, degrees motivations, and self-care ability. And next is medications management. So to ensure adherence and prevent side effect or relapse. And next is we need to encourage the patient participations in activity or socializations to reduce isolations and promote functionally recovery. And then monitor substance use, sleep, and nutrition. So, to prevent relapse and support na rin sa physical health ng pasyente. And the last one is to provide emotional support and psycho-educations to help both patient and family and to help both patient and family to understand the illness and cope better. So, proceed tayo sa nursing care plan. For the nursing care plan is for the diagnosis, disturbed thought process, or chemical imbalance. So the goal of this is patient will verbalize reality-based thinking within 2 weeks. And for the interventions is provide reality orientations and administer medications and reduce stimuli. And for the rationale is reality testing and medications reduce hallucinations and improve thought process. And for the second nursing care plan is the diagnosis is self-care deficits, cognitive impairment. So the goal of this second nursing care plan is patient will perform basic hygiene with minimal assistance. And for the interventions is encourage independence, assess PRN, and establish routine. And the rationale of this is to promote independence and prevents neglect. And the last one nursing care plan is For the diagnosis is risk for violence, hallucinations, and poor impulse controls. So the goal of this nursing care plan is the patient will not harm self or others during hospitalizations. For the interventions is we need to maintain a safe environment, remove harmful object, and de-escalate agitations. And for rationally is safety is the highest priority in psychiatric care. So for the nursing management, actual and PI, so during my interactions with Richard Del Campo, I was able to use therapeutic communications like listening, validations, and reassurance. And then, ina-assess ko siya with hygiene and activity daily lifestyle, and encourage social interactions during group activities, and ginaguide ko siya calmly to his room with agitated, and reinforce positive behaviors and medication compliance. And proceed tayo sa recommendations. For the recommendations is continue long-term antipsychotic treatment to prevent relapse and stabilize symptoms. And the second is enroll in community mental health programs to provide structured therapy and support. And pangatlo is strengthen family and support and counseling. The family plays a key role in recovery and adherence. And pang-apat is participation in psychosocial vocational activities to improve coping skills and independence. And pang-lima is address substance use through rehabilitations to prevent relapse and promote physical health. So, and the last one is promote healthy lifestyle and structure routine to enhance stability and quality of life. And then proceed tayo sa discharge plan. For discharge plans, Richard will continue antipsychotic medications and follow-up appointment. And next is have a family monitoring for compliance and early relapse signs, and be enrolled in community rehabilitations and support groups. And also maintain a healthy lifestyle and avoid substances, and also the follow structured daily routine with meaningful activities, and have an emergency plan so his family knows where to seek help during relapse. So, proceed tayo sa last slide, the conclusions. For the conclusions is schizophrenia is a lifelong illness requiring holistic care. So, Mr. Richard Del Campo highlights the importance of pharmacology treatment, nursing interventions, family support, and rehabilitations. With the proper management, Richard can live functionally and meaningful life despite his illness. And that's all. Thank you po.